Hello, good evening, salam sejahtera, and welcome everyone watching this live stream. I'm your host and the moderator, Alan Tay. I've been asked to moderate this on behalf of MMA SCOMOS, who has kindly organized this session, which is titled Conversation with the Experts on the COVID vaccine, okay, or COVID vaccine 101. Okay, I'm not one of the experts, so though I'm a medical doctor, but I'm going to introduce the real experts for tonight. So, without further ado, I'm so honored and pleased to introduce my former colleague at the University of Malaya, Dato Professor Dr. Adeeba Kamarulzaman. So, hi Adeeba, how are you? Okay, now
Hi,
Professor
Alan.
Adeeba,
Very good to be
yeah,
here. Thank
yeah.
you.
I have to say a few words. Professor Adeeba is a professor of medicine and infectious diseases at the University of Malaya and an adjunct associate professor at Yale University. So she was the Dean of Faculty of Medicine from UM until recently, 2019. So she was a member of the Ministry of Health Advisory Council and is presently a member of the Selangor Task Force on COVID-19 and also co-chairs UMMC's COVID-19 Task Force. Now, she has played a leading role in the response to the HIV epidemic in Malaysia and globally, and is also currently the president of the International AIDS Society and a member of the UN AIDS Advisory Group and WHO Academy's Quality Committee. She was a co-chair of the WHO Strategic and Technical Advisory Committee for HIV, the STAC, from 2011 to 2016. Now, her achievements have been recognized through several national and international awards, including an honorary Doctor of Laws from her alma mater, which is Monash University, for her contributions to medicine and as a health advocate. So I think we're very privileged to have you online tonight, Adeeba. And I'd like to introduce our second esteemed guest, and no less, I'm sure you all know him, is Dato Dr. Musa Muhammad Nordin. He's a 1982 graduate of Cardiff University and is currently a consultant pediatrician and neonatologist at Damansara Specialist Hospital in Kuala Lumpur and clinical professor of pediatrics at the KPJ International University College. Since 1999, he has served on various international advisory boards related to vaccines and immunization. His latest book, Immunization Controversies, What You Really Need to Know, has been translated into 4 languages. So welcome, Musa. How are you doing? You okay?
I'm fine. Thank you very much, Alan, for that very generous introduction.
Sorry if I took too much time with the intro, but I think not everybody is familiar with our panelists today. So what I'm going to do is also engage the people watching. So what many of you are watching in YouTube, and also hopefully if you got it right at the MMA SCOMOS Facebook, which I hope I got the stream correct. It should be streaming live to MMA Facebook. If not, just watch in the YouTube. And I think we got over 800 views now, live views. This is
Wow.
fantastic. Yeah. So we are going for interaction. Before we start, I would like you all to use Slido. Now, Slido is an audience interaction tool. You just go over to slido.com and then enter the code 6469 in your browser. Okay, if you're using a mobile, you may need to juggle a bit between watching a YouTube and then switching to the Slido on the browser. Or if you've had it already, there's also a Slido app for your mobile. All right. Now, to give you all some time to get on Slido, I'm going to switch the share screen to the Slido one now. So head over to slido.com 6469. You can also use your barcode scanner and scan that. It will take you to the same page and automatically log you in. All right. Now, the first thing I want to do as a warm up is to ask you guys a basic question. We'd like to know who's watching this stream. The young ones, older ones, not so young, middle age, which is for some of us that's 60 to 80. That's middle age. Not so sure. You 40. Never mind. I'm living in fantasy land. 40 to 60. Okay, looks like mostly 20 to 40-year-olds watching. Yeah. Okay. Nobody very young or nobody very old. Okay. All in the middle. Very nice. Thank you for using this interaction tool. So I think we've got that engaged. Now, I'm going to ask you next is who exactly is watching, because we like to know. This is a public stream, so we are not sure whether it's doctors, nurses, other healthcare professionals, includes pharmacists, okay, physiotherapists or whoever, medical students, or perhaps you're just you're a member of the public who's interested to know about vaccines. Okay. Wow, it looks like mostly doctors are interested, maybe because they're going to be among the first to receive the vaccines when it comes. And I think there are some questions. 10% members of public, some nurses, and some other medical students, I guess, are very busy and they have no time to watch anything. So there are no medical students watching currently. Thank you. So yeah, so 3/4 are doctors. So good evening out there, colleagues. All right. And this one is a little bit different. I'm going to ask you all, what are your concerns about the COVID-19 vaccines? Okay, this is a word cloud sort of thing. So you just type your concerns and you'll appear on screen. And the bigger the text, the more people chose that term. So okay, go ahead. You can enter more than one, as many as you are concerned about.
Wow, very smart, lah, Alan, this one.
Oh yeah, no, it's quite clever. I like the software.
Yeah.
So it looks like safety, side effects are topmost of people's mind. Efficacy as well. Yeah, whether the vaccines are effective. So we hope to address these issues in our chat afterwards. Yeah. Okay. All right, that's good. Maybe give about 200 plus to express their thoughts. Okay. So if you just join us, we are going to use interaction at slido.com. Enter the code 6469 to join us. Okay. We will do some polls at the beginning before we go on to the actual chat with our experts. Then in the end, we'll use this slido.com also for any Q&A. So if you've got any questions for our panelists, you enter the questions in Slido and we will bring it up on screen to share with our esteemed panelists. Okay, so safety, side effects seem to be topmost. And then lastly, the last one, and I'm going to repeat this at the end of it to see whether there's any changes after listening to what we have to say. So if there are no contraindications, would you be willing to take the vaccine? Okay, this is anonymous, so feel free to express your willingness. Okay. Got.
Oh gosh, we got a tough job, man.
20% unsure, but only 3% no, sir. Only 3% no.
Sorry, 20%. Oh, unsure. Yeah, these are the.
That's not bad. That's not bad, sir. Nearly 80% say yes, because I think the Nature survey wasn't globally was only about 60%, I think.
Excellent. Okay. Now we will repeat this later to see whether we can improve this 73/4 to maybe 80, 90%.
Or we fail.
Oh, we fail. Yeah, you might drop. Okay, so all right, let's go back to the Slido is still there. You can continue voting your willingness to receive the vaccine or not. But we will talk a little bit next about the current situation, and I've just put in some screenshots on the situation today, which came out in the news, and I think we've been, unless you've been living under a coconut, you realize that it's about 4,000 cases a day now. And today was a record 18 deaths. Okay. So, but slightly lower at 3,006, but it's been hovering around 4,000 cases. And what is more alarming is this thing which was reported in the Code Blue Galen Center. And they've actually looked at it and you say that actually we've got more cases than Indonesia and the Philippines if you consider number of cases per million population. So we've actually exceeded Indonesia and Philippines in the top 20, and it's rising fast. So, Adeeba, what are your comments about this these figures and the current statistics and trends?
Well, after our great control of the first and second waves, this is, of course, very disappointing. And we're actually witnessing it at our hospitals and also in the testing programs that the Selangor Task Force and Imaret carried out a few weeks ago in Klang. I think these figures are real. We are seeing, certainly seeing more symptomatic cases and more severe cases in the hospitals, which goes to reason, right? If you're having more people infected, you're going to get more of the those at risk who are going to develop severe complications. Even if overall that figure is 10% of those infected get severe complication, but if you are 10% of 4,000, you're going to get more than what we had before.
Yeah.
So I have no doubts that these figures are real. I would take the figures from Philippines and Indonesia with a pinch of salt, not to diminish, the healthcare capabilities there, but perhaps they're not testing as widely as we are. I mean, Musa is going to say we're not testing enough, which I tend to agree, but in comparison to Philippines and Indonesia, maybe we're not. I mean, they're not testing widely, hence the ranking as we see it. But without a doubt, unfortunately, we're continuing to see a rise in infection, and it is, a cause for great concern.
Okay, over to you, Musa. You were featured in this article, and you were quoted as saying we are in danger of having perpetual movement control orders if we don't get our strategies right. Maybe you can elaborate, and it's sort of like continuation on the current trend, which is quite alarming.
Yeah, personally, I'm not a fan of lockdowns or MCOs, as we call it in Malaysia. And I think we will be trapped in this vicious cycle of MCOs and lockdown if we don't get our back to basics right. And when I say back to basics, I mean the finding, the testing, the tracing, the isolating, and the support systems. Yeah. So we need to be really smart at capturing areas where we need to triage and do mass testing. Yeah. I'm happy to note that our testing zero positivity has actually dropped from a high 9%. It's now just, I think the 20th or 19th I checked, it was 5.7%. But good nations are bringing it down to below 5, even better, below 3%. But we need to test with rapid antigens, not with PCR. This obsession with PCR, we just need to as a public health surveillance tool, it has to be the rapid antigens. Yeah, you use your PCR for your diagnostic tools in your hospitals, in your universities. So because with it, then you can isolate them early, and within 2 days you can trace and isolate them. So I think, and of course, we need this package to support the rakyat. I think if you get these very basic fundamentals in order, unless you get in order, then we are trapped in this vicious cycle of MCOs.
Yeah, we hear you. We hear you. But now, aside from all this detecting, isolating, etc., I mean, will vaccines be our savior? I mean, this is the topic of today's chat, and everybody is waiting to hear about the vaccines. And I think there are quite a number which are currently available under emergency use around the world. The Pfizer one, the AstraZeneca, Moderna, the Chinese Sinovac, Russian Sputnik 5. I'm going to hand over to Adeeba. It's not going to be a lecture. This is a vaccine 101.
Yeah, don't worry.
So it's not going to be a scientific lecture on vaccine, but just something quick overview. Adeeba has provided some slides, so I'll just bring them on screen now. So maybe Adeeba, you can take us through what.
Sure, but before I talk about the slides, I just want to address what you said. Is the vaccine going to be the magic bullet? And the answer is no. Like with all diseases, you have to combine vaccine with continued public health measures, and behavioral changes, because no vaccine is going to be 100% effective. And furthermore, with this SARS-CoV-2 COVID-19 vaccine, we are aiming for 70% herd immunity. And for a virus that has not been in the population, that means we have to vaccinate a whole lot of people. And if the vaccines, as our our minister said, will be coming in March, it's going, and you need 2 doses, you need to cover 70% of the population. It means that we're well into at least the middle of next year, if not longer, before we reach the desired coverage. Would you agree with that, Musa?
Oh, definitely. Yeah.
Yeah. So in the meantime, we will need to continue with all the public health measures and interventions. And even when you have the vaccine, you should still continue with masking and distancing, etc. So a little bit about the vaccine. Of course, the very fact that thousands and thousands of people have been vaccinated just under a year since the disease was declared a pandemic is nothing short of a miracle. Yeah. And we have, I think, currently over 200 vaccines in various phases of development. Might be a bit hard to see there, but there are 20 or so vaccines that are in late stage development. So as you read out, Alan, 8 have been approved in various countries. The 2 refers to Moderna and Pfizer in the US, and 1 vaccine platform has been abandoned. So, but there is intense research and science and clinical trials going on at the moment with the vaccines. The next one is just very, very briefly, there are 5 different types of vaccine initiatives. The 3 most advanced, of course, the mRNA vaccine, and then you've got the protein activated vaccine. Can you move your slide, Ellen?
Yep. Hang on.
Yeah. Protein-based and the viral vector vaccines. Yeah. So all of you have heard of the mRNA vaccine, which is the technology used by Pfizer and the Moderna vaccines. Protein-based vaccine, there is one advance in clinical trials in the UK that's developed by, I think it was Norway, if I'm not mistaken. And then the viral vector vaccines, the Johnson & Johnson vaccine is one of the examples of the viral vector vaccine, and the Oxford AstraZeneca is also an example of the viral vector vaccine. This cartoon is just to briefly explain how it works, but as you said, we're not going to go into an vaccinology 101. Okay, and there's a lot of questions about the mRNA vaccines, and because it is new, but it is new and it's not new. Actually, this vaccine technology has been developed for a long time in other diseases. It's been in preclinical trials for a number of diseases, including Zika and Ebola. And so the technology has always been there, and research around coronaviruses have been ongoing for decades, especially since the original SARS virus. So when SARS-CoV-2 came along, it wasn't like they had to start from scratch, like with the HIV vaccine, where it was a totally new virus, and retrovirus that was not known. Whereas the SARS-CoV-2, there are basic elements, lots of signs, lots of signs known about the coronaviruses. So it was adapting, there was a lot of sharing also amongst the scientists of genomes, and that was adapted into an already existing platform, the mRNA platform that was being developed for, as I said, Zika and Ebola, etc. So the other question is, of course, that the mRNA is going to get incorporated into human DNA, and that just doesn't happen, because you need specific enzymes for that to happen. So it's not going to be incorporated into human DNA. What it does is it carries the spike, the famous spike protein, through this vehicle, and then when it enters the human body, the immune system recognizes it and then produces the antibody response. Next, then the viral vector vaccines. These are long-standing technology for vaccine delivery, and as I said, the Johnson & Johnson and the Oxford vaccine, the AstraZeneca, use this viral vector, and then the Chinese vaccine, the Sinovac, Sinopharm, use inactivated vaccines, which again a type of vaccines that's used for many other different diseases. Okay. Okay.
Okay, next. We will. That's your last slide, I think.
Yeah, that's my last slide.
Okay, so we've got all these choices and the different mechanisms for these vaccines. So the question is, how effective are these vaccines, and will the differences between the different types of vaccine make any difference? So over to you, Musa. What are your comments about effectiveness? Because that was one of the major concerns in our poll.
Yep. Just before that, the fourth modality that was probably missed by Adeeba is the inactivated and live attenuated vaccine. This is the classical, because because we will be having the Chinese are making entries into our market with their Sinopharm, which is an inactivated vaccine, and Sinovac, and the Pfizer and Moderna has an efficacy of 95%, i.e., they prevent infection in 95% of the vaccinees. What's extremely important from that data is that those 5% who were actually infected were category 1, category 2. None of them in the Moderna suffered severe COVID disease, i.e. category 4, category 5. So that's amazing, isn't it? Because you prevent severe disease, which means less presentation to the hospitals or the ICU, i.e. you protect the capacity of the hospital. That's extremely important. And also, this protection of 95% is across the board, from the young to the geriatrics, across gender, across race, across ethnic groups, because in the United States, when they did the Pfizer trial, it was in 99 sites, covering the whites, the blacks, the Latinos, the whole lot. So it has served the niche. Its efficacy is comprehensive. The Moderna vaccine similarly, right? And with the AstraZeneca that was done in 3 places, there were some issues initially, but the efficacy, taking into account the half dose, full dose, is about 70%. Yeah. So it is registered for 70% efficacy. But that's extremely good because the WHO and the FDA puts the bar at 50% efficacy. So I think they've met the minimum requirement, and you must remember, MMR is 98%. The influenza vaccine use is about 60%. So this is really amazing. I think as a pediatrician who does half of my work in the clinic is vaccinating, this is a revelation. I'm overjoyed in terms of efficacy. Yes, Alan.
What do you think of the data publicized about the Sinovac, which was around 50, in the low 50s?
Okay, now the issues with China and Russia is that there are no published trials in peer-reviewed journals. The only publication was from Sinovac for their phase 1 and 2 trials, telling that the GMTs were met, geometric mean titers were met, and there were no safety issues, no reflex. But none of their phase 3 trials had been published. All in press releases. This is what they call peer review with press releases, which is very frustrating for guys like Adeeba, who are science centric, And Sinovac has got three bases. Turkey claim 91%. They've got about 2,000 volunteers. Very small numbers. Small numbers because when you compare with Pfizer, 43,000, you compare with AstraZeneca, 20,000, and you compare with Moderna. Moderna has got 30,000. I mean, nearly 100,000 between the 3 of them. Sinovac in Turkey is about 2,000. And then the Brazil study and the Indonesian study. Now, the Indonesian study was 68% efficacy. Okay lah. The Brazil study was anything between 51% to 78%. And the Turkish study was 91%. Now, the Sinopharm was used as EUA in Abu Dhabi, in the Middle East, yeah? And they claim 86%. So okay lah, in terms of meeting the FDA and WHO bar, they're fine. But no publications.
Oh, that's point. Good point. Adeeba, any thoughts about effectiveness and especially different mechanisms, different types?
No, I think Musa has very eloquently described the kinds of very, very high level of effectiveness seen in these vaccines. Yeah, the important thing to note is with the Pfizer and Moderna vaccine is that it prevented severe disease, and that's what we want, isn't it? The biggest trouble with COVID-19 is, one, it's asymptomatic. On the one hand, it's asymptomatic and leads to all these public health problems. And 2, although 10% get severe disease, but the severe disease, can lead to significant morbidity, even if the overall mortality with good treatment is not high. And you must also remember that there is such a thing as long COVID. So, the long-term complications of COVID. So, the race to produce this vaccine and to make sure that as many people are protected as possible is, totally justifiable. Yeah. Not to mention the kind of economic damage that the pandemic has caused all over the world.
Yes, Musa, you wanted to say.
Yeah. So the primary objective of the trials was prevention of COVID disease. It was not designed to prevent spread. Yeah, that is a secondary objective. But there actually hints from the Moderna study and from the AstraZeneca study that it actually prevents the asymptomatic transmission of COVID disease. In fact, they showed in the, I think it was the Moderna study, there was a 30% reduction in asymptomatic carriage. So this is really good, because if you get this indirect protection, i.e. you don't spread the disease, then it is much, much easier to achieve herd immunity or the group protection, community protection.
Some may be very concerned about the short time it took to develop this vaccine, what Donald Trump referred to as Operation Warp Speed in the US. And it's amazing how fast the companies could actually come up with a vaccine. So is it an impact on the safety? That's the other big concern folks have.
Yeah, I think I alluded to it at the beginning, Alan. It's first of all, the virus, although it's a new virus, belongs to a family of very well-known and well-researched virus. And so, it didn't take long for experts working in coronaviruses to rev up their activities. And particularly, there's been a lot of funding towards this vaccine put in by Europeans, Americans, etc., etc. So funding and scientists getting together, working on a virus from a family of well-researched, well-known viruses. Secondly, like I said, all the technology, the platforms, the virus platforms, whether it's the mRNA or the viral vectors or the protein base, these didn't have to be designed from scratch. Years of developing coronaviruses, flu vaccines, coronavirus vaccines, HIV vaccines, Zika, Ebola. So all these platforms are already available. And as I said, the mRNA vaccine platform, although it sounds new to all of us, actually have been in preclinical trials for quite some time. And in fact, now there's going to be a clinical trial using mRNA for HIV using the mRNA technology. So it's not new, if you like. And that's the same. Of course, the inactivated vaccine is a familiar platform. Thirdly, it was not difficult to get volunteers to come forward for the phase 1 and phase 2. And also the phase 3 studies. So yes, in the past, recruiting volunteers can be difficult, but also we were able to show the efficacy because the pandemic is raging at the moment. And so when you recruit the volunteers into the study, you're able to make all these analyses because there's a raging pandemic. So at least for the Pfizer's, the AstraZeneca's, the Moderna, and all that, we're very confident that it's gone through all the necessary steps for that any vaccine development need to undergo, i.e., the animal studies, the phase 1, phase 2, phase 3 studies to ensure that we have a safe vaccine.
Okay, so that will address the short time to development versus safety.
Can I just add one point, Alan? I think this question is very critical. We must address it because not just the anti-vax, the ordinary public will say 10 months for a vaccine when it used to be 10 years. The shortest duration to develop a vaccine was the mumps vaccine, which took 4 to 5 years. So I think Adeeba made it very clear. This is technology that has been with us since the 1990s. And she mentioned Moderna. Moderna has got 7 candidate vaccines, in phase 2 trials. She mentioned Zika, cytomegalovirus, chikungunya, influenza. But they're stuck at phase 2. Why? No funding, ma. So when the states government gave 1.5 billion USD it just ramped up their trials. Yeah, and Moderna, when the Chinese gave the genome in January, within 2 months they got the mRNA vaccine. They were the first to jab it into the muscles, right? And they worked very closely with Fauci. Fauci is the National Institute of Health. So you got a
He's been working on HIV vaccines for as long as I've known him.
So there you are. So there is good signs. Yeah. What was actually ramped up was not the phase 1 to phase 3 trials, but the regulatory, the licensing, the emergency use authorization that was ramped up by the FDA, by the MHRA in the United Kingdom, by the European EMA in Europe. So that was ramped up. Okay.
Yeah. So we got the vaccines now. So people might want to know who in Malaysia should get the vaccine first, who are eligible and who are not eligible. What are the contraindications to the vaccine? So maybe either of you want to elaborate? Perhaps Musa will give you you vaccinate a lot of your patients.
That's my bread and butter, ma.
So who should be vaccinated first in Malaysia?
There must be a very careful balance between preventing mortality and morbidity and making sure that the society functions. Okay, so preventing morbidity and mortality, who are the highest risk? They are those like me lah, above 60, 65 years old, high risk. Those who have comorbidities, right? Those who are in home care, these are very, very high risk. So that is, hopefully we can reduce the deaths and the disease associated with COVID. And then we need to get society running, ma. So we must make sure the hospitals are there. So we need to vaccinate our healthcare workers, right? And then the other essential services, our guys in the front line, the bomber, the police, and then those who essential goods, yeah. So these are the essential workers. So I think that is the first priority, in my opinion.
Maybe the grab food delivery boys to frontliners.
No food then.
So Adeeba, you got any thoughts on this? Who should
get? I totally concur with Musa, and of course, in congregate settings where spread is very well known, like prisons and detention centers, and one can argue in foreign worker dormitories. So, this is where issues of equality and equity. Who do you give it to? And Musa has already outlined some of the principles behind it. So I want to add, the other at risk where high risk, in addition to nursing homes, would be places like prisons and dormitories.
Yes, you know what the government has done? Wow, this is really proactive thinking, because Selangor's GDP contributes 24% of the country's GDP, and it's all based on industries, right? And the migrant workers, they've got something like about just under 1 million migrant workers, right? So they've set aside X million, to vaccinate these migrant workers who would otherwise be the lowest in the list, And the other group that they've already thought about are the refugees. There's about 150,000 in the whole of Malaysia and 100,000 in the Klang Valley. So the state government has set aside X million for this. They are the occult, silent epicenter of any vaccine preventable disease. So I think this is really smart thinking lah.
Right.
Kudos to STFC lah. This one Adeeba punya kerja.
Kudos to
Selangor. No, cannot take credit for that.
Who cannot receive the vaccine? What are the contraindications? Maybe we can educate us, Adeeba.
So I think the first major one is those with a history of severe allergies and anaphylaxis. But other than that, and obviously people who are immunocompromised, undergoing chemotherapy and has an acute illness at the moment. There's a raging controversy going on at the moment about people living with HIV because they've been excluded in some vaccine programs. But actually, HIV itself is not a contraindication, provide if you are stable on treatment. So although pregnant women were not included in the clinical trials, currently there is not a contraindication, pregnancy and breastfeeding. But of course, you need to inform the mothers and lactating mothers in particular that they were not included, or pregnancy and lactating mothers were not included in the studies. But there's no reason to exclude these ladies from the vaccine currently. And children are not a priority at the moment, because we know that children, and this is Musa's area, I shouldn't jump into his area, are less likely to have severe disease. And also both the Moderna and Pfizer vaccines, I think one vaccinated 16 and above, the other 18 and above. But the children are not contraindication, but I guess it's in terms of priority, they're not in the list of priority vaccinees at the moment.
Yeah, FDA approved for the Pfizer vaccine 16 years and above. Moderna was 18 years and above, and I think both of them are now. I think it's Pfizer that's doing trials right down to 12 years old. Yeah. The only absolute contraindication is actually anaphylaxis, any form of anaphylaxis. If you remember the two nurses in the United Kingdom that had an anaphylactic reaction after the vaccine, within minutes, within 15 minutes, they had previous histories of anaphylaxis. In the United States, they have already distributed, or rather administered, about 7 million of the shots. It's a bit disturbing because there's about 11 per million anaphylactic reactions. Because if you look at the influenza vaccine, and all of the vaccine is about 1 per million, so it's actually higher than the other vaccines, 11 times. And because the vaccine is under microscope, so everyone's looking at it with really sharp eyes, acute eyes, is worrying. But you ask the doctors in the panel, the allergy to penicillin is 1 in 5,000 anaphylaxis to penicillin. But no big deal, isn't it? So 11 per million. That's why it is mandated that you must have it done in a setting that is ready, prepared for an anaphylactic reaction, i.e. you have your epinephrine, you have your intravenous fluids, you have for CPR, and you must be in that setting for a period of 15 to 30 minutes.
The other reason why it's apart from the spotlight is because tens of thousands of people are being vaccinated at the same time. So you're going to get, many of these cases popping up everywhere. If it's, the ratio that Musa has said. Now, in the US, they've done quite detailed risk-benefit analysis of the vaccine versus no vaccine, and certainly the benefit of being vaccinated far outweighs getting the COVID-19 infection.
Okay. Before we go on to the side effects, which was the major concern in our word cloud, people are worried about the side effects. I just want to say about the contraindication, because this also reflects my practice, and this I'm not sure what the answer is. What about people who are not heavily immune suppressed? Say low-dose prednisolone for an autoimmune disease. Can they have the vaccine? Is there a contraindication?
Oh, I just had to look at the FDA's recommendations. Those who have bone marrow transplant, those who have solid tumors, HIV. There was 176 in the Pfizer arm for the vaccine, so not a contraindication. Those who are immunosuppressed, on steroids, it is not a contraindication. Stabilize the disease. All the reasons for you to be immunized, because you are high risk of suffering from category 4-5 COVID. The only thing is that the protection may not be as good as as
It
giving
may
the
not work
vaccine.
as well. May not work as well. Yeah. Yeah.
That's it.
Yeah, the only proviso is if any of these patients have an acute infection at the same time. For instance, your hematology patients have secondary bacterial infection, or then you would wait until those acute infections settle down before. I mean, that's just normal clinical practice, isn't it? You don't go around vaccinating someone who's unwell. Yeah.
Yeah. Okay, so we go on to the concern of the majority. What are the side effects we can expect from these vaccines?
Over
Acute
to you,
and late
Musa.
side effects. Yeah, Musa, what is your thoughts? What do you expect for the early side effects and any late side effects?
In any vaccinology trial, you must give a grace period of 2 months, 60 days. Because within this 60 days, you will know which are the major side effects. Yeah? Because look at some of the side effects. For example, anaphylaxis. Within minutes, within 50 minutes, you will see it. It's not going to happen 1 year later. Then, with interception, with the rotavirus vaccine, within a few days, with idiopathic thrombocytopenia, ITP, idiopathic thrombocytopenia, where the platelets just crash. That happens within weeks. Yeah, with the MMR vaccine, with the yellow fever vaccine, encephalitis within days. So you see it. So, but the scientists said yes, give it 2 months, and so far with the 3 vaccines, the AstraZeneca, Moderna, and Pfizer, we've not seen any red flags. We've not seen any safety signals. Okay, so I think we need to be very clear. This is the state of the science, right? Why we do pharmacovigilance after it's like now they've got 7 million. They've seen 7 million. They've not seen any major adverse effect following immunization, AEFI, except for the anaphylaxis. Yeah, that is 11 per million. So I am reassured that as far as the 3 vaccines that's been licensed EUA is concerned, it is safe. And just to give you a perspective of risk benefit, the risk of you dying from COVID in the United States is 1 in 300. In Malaysia, the case fatality rate is 1 in 250. The risk of you getting an anaphylaxis reaction is 1 in 100, 1 in 300,000. So you compare that, dying from COVID and anaphylaxis reaction from the COVID vaccine is 1 in 300,000 compared to 1 in 300. So get the science right now.
Yeah, but people are always worried when they're inundated with news reports like 20-year-old folks in Norway died after receiving the vaccine. The odd doctor in the United States has a severe thrombocytopenia after the vaccine. Your comments, people, and this spread virally on social media.
The Norwegian study, right?
Yeah.
To start, it was not 23. It was 23 were 23 were infected, 14 died, 9 had the disease. Okay, and the Norwegian authorities said that all the deaths that happened were not related to the vaccine. This is the influenza vaccine in Korea playing again, lah. When the Koreans rolled out the influenza vaccine, for their winter, there were 170 deaths. And what did Malaysia do? Stop the influenza vaccine. Singapore stopped the influenza vaccine. But the Koreans, I must respect them. You know what they said? This has got nothing to do with the vaccine. This is just the preceding comorbidities. And true enough, when they did the analysis, when they did the autopsies, none of the 170 deaths were related to the vaccine. So this is just a playback, man. And so Adeeba may want to add,
Yeah, I mean, like I said, we are vaccinating a lot of people at the same time, and particularly in this first phase where the target people, population to receive the vaccine are, especially in Europe and all those places, are the elderly and people who are at risk of dying from other non-vaccine related problems like strokes, cardiac, heart attacks, and so forth. And so, like what Musa said before, there's so much scrutiny, and one is the intense scrutiny, and rightly so, every death is looked into. But second, because so many people are being vaccinated at the same time, so you've got this concentration of side effects, adverse events, whatever you want to call it, happening at the same time. In the past, you're vaccinating people, these things are also happening, but you don't hear about it because it's happening in different places in diluted numbers. But now it's a concentrated number of people being very quickly vaccinated. Hence, there's an amplification of what would otherwise be normal events.
But Alan, you see, our reason is this misinformation and fake news that's going about. I mean, classically, you remember the Pfizer study? There were 6 deaths. You know what they said? 6 people died from the vaccine, which is a lot of mistruth lah, misinformation lah. Because 4 who died did not take the Pfizer vaccine. 2 died were in the vaccine, but they died because they had a heart attack. 57 days, one of them, after the vaccine. And then remember the nurse that took the vaccine and suddenly fell, and the anti-vaxxers went around the world and said, you see, the nurse died from the vaccine. The nurse woke up and said, hey, biasalah, I kalau kena injection, I pengsan lah. This is a vagal response. And then you remember the other lady that I think it's black lady. She had this what palsy is that? Bell's palsy, yeah.
Yes.
And then when they checked the record in Tennessee, there's no such person. This is really disinformation. This is fake news from these anti-vaxxers. So this is what that's worrying the layperson, the hesitant person, and of course the anti-vaxxers. They write on this misinformation.
Yeah, I think good point, and I think I hope the message goes through. Okay, it's actually a lot of it is just the media wants to sell their newspaper, so it's a lot of sensationalism. What about? I know it's not.
Sorry, Alan. Perhaps it's worth mentioning that for any new medications or vaccine that undergo clinical trials, for those of us who have participated in clinical trials, it is the nature of the clinical trials that you report every single minor or major side effects. You know this very well yourself. So, which then can be misconstrued, whereas it could just be background, side effects that would happen anyway.
Yeah, everything is an adverse effect in the trial.
Everything is an adverse event.
But it is not necessarily linked to the study drug. Yeah,
correct.
Exactly. What about late side effects? I know it's a bit not fair. It's a bit early. Maybe some of these concerns are theoretical, like autoimmune disease in mRNA vaccines, perhaps because of the nature of the protein synthesis, etc. What are your thoughts? Is this all just theoretical and not of any concern? Or are there any other possible late side effects like neurological and things like that, which may happen?
Well,
it's very rare to get. Yeah, go on.
Yeah.
As a whole, late side effects in vaccine is uncommon. But of course, with this vaccine, like everything else that's new, you just need to monitor and monitor the development of these side effects, if any.
That is why both the Pfizer and Moderna trials will go on for a good 30 months. Then you can, through this process of post-marketing surveillance, or what's known as pharmacovigilance, you can look at the rare side effects. Yeah, and yes, it's a concern, the autoimmunity. But when they look at the studies, there's 100 or so participants, volunteers in the study. There were no issues of autoimmunity to the spike protein. There were 2 cases of transverse myelitis, i.e., producing antibodies against the myelin sheath in the spine, right? That was also been, they halted the trial for a while, but then they did not show the association. So, this autoimmunity is something that the anti-vaxxers really love to harp on. They did this with the HPV vaccine, and I read a brilliant expose by Paul Offit, debunking this autoimmunity. Yes, there is a concern, but so far there's not been any safety signals, no red flags in the 100,000 or so. And when you look at the major side effects, there are about 1% in the control group, and similarly 1% in the vaccine group. So there's no significant difference between the two. Yeah.
Okay.
But yes, we'll follow through for those very rare side effects.
Okay. All right. We'll have to move on. We'll quickly finish up with the rollout in Malaysia. Anybody can give us a timeline for those who are anxious to get a vaccine, or what? Any
Adeeba has all the inside information.
Yeah.
No, I don't. But from what I know, as you all know, hopefully, inshallah, we'll get the Pfizer vaccines in March. And from what little I know of the Malaysian vaccine rollout plan, there's a nice plan being put together by the Ministry of Health. And as expected, I think the first 1 million doses will hopefully go to the frontliners, and then the second group will be for warga emas, and 3.5 million to mereka yang with diabetes, hypertension, people with comorbidities, and then followed by rest with no clear comorbidities. So and I believe Ministry of Health has mapped out where the vaccine centers, etc., will be.
Yeah, I don't think we have time to go through all, but there is actually a plan and a process of enrollment and various phases.
Registration in My Sejahtera, and for us frontliners, we've given our names to our hospital Kamara, etc.
So, okay, we have about a ton of questions now lined up, and maybe we answer them. Okay, we will head over back to our Slido, and here are the questions which are concerning the listeners. Yeah, so we'll go with the leading questions, and the number 1 is from Abdul Rahman. What is your opinion of the requirement of no-fault compensation for vaccine if there's an adverse or long-term effect after phase 4?
Okay, just a bit of history. In the 60s and 70s, when they rolled out the DTP, right, vaccine, there was litigation against what was supposedly abnormalities in the children who got the pertussis vaccine, abnormal behavior, autism, delayed milestones. Yeah. And so they were suing the companies left and right until there was only one company making the DTP vaccine, diphtheria, tetanus, whooping cough. So the American government stepped in and said, we will give compensation if the adverse effect is genuine, related to the vaccine, and we will protect the companies so that there will be companies making the DTP vaccines, right? So it's benefiting those who were affected by the vaccine, by the injuries of the vaccine, and also the companies would continue to produce the vaccine. So they have what's called a vaccine court in the United States of America to judge, like they judge MMR, not related to autism. So you don't get compensation for that. But with chickenpox, there is some form of neuroencephalitis. They get compensation for that. And industry pays X amount from every vial of vaccine, right? That would build this bank to pay for the vaccine injuries. So I think we need to have a similar vaccine court in Malaysia, so that the pharmaceutical company will be protected, i.e., right? So that there will be vaccines being manufactured. If they withdraw from us and don't give us the vaccine, then susah lah kita kan. If Pfizer is not going to get that protection, they will remove their 40% allocation. AstraZeneca will remove their 10%. Okay? So, but there must be the vaccine court. If there is genuine injuries, those vaccinees will get the compensation. So that is
there's both sides of the coin. Definitely both sides need some protection. We move on to another question. If the person had COVID-19, should they still get the vaccine, and when can they safely get it? So if you had the infection before, can they still get the vaccine?
Yeah, so a quick answer to this, much as there's been huge amount of progress in COVID-19 science and knowledge in just under a year, there are still a lot of unknowns to the disease. And one of these unknowns is following a natural infection, how long does the immunity last? So the quick answer is yes, you should still get yourself vaccinated, because we don't know how long the natural immunity lasts for. And having said that, the immunity from vaccination, because this is only going on for the last 4 months, there's studies from Moderna up to only 4 months. When can they safely get it? Like with any other diseases, it's once your acute illness is over.
Okay, we move on. This is about rollout. Can we expect that vaccine be available at private clinics and hospitals? I think we mentioned that briefly, isn't it? So there's the national plan. The names have all been submitted or in the process of being gathered. And then the rollout should be by March. Am I mistaken, Adeeba?
Yeah. The first. That's as much as I know as well. Yeah.
I think the lactating question, is it okay? We've covered that, Adeeba, saying that it's not a contraindication, but they have been counseled that it's not. It was not in the trial. Yeah. But as far as we know, it's not a contraindication. About viral mutations, okay, and there's a concern whether the vaccines will be less effective for the new mutant strain. So, any comments from you guys?
Yeah, the B117 in the UK is creating a lot of havoc. There are 23 mutation on the epitopes of the spike protein. But they've done the assays of neutralizing antibodies, and they found that the ones in the convalescent plasma and the ones induced by the vaccine, no issues at all, right? We are still waiting for the studies from South Africa with regards to that mutant strain. But it's extremely important that we do the 2 doses, i.e. Pfizer, 0, 21 days. Moderna, 0, 28 days. Then we make sure that we get that 95% protection. We don't give a chance for an escape mutant strain. That's very important. If you half-hearted 1 dose only, then you allow the strain to develop resistance, right? And that's dangerous. So I think because there are some thoughts in the United States of America that we want to do as many as possible, just 1 dose. No, it doesn't work that way. With 1 dose, right? In the Pfizer trial, by about 2 weeks you get 50% protection. In the Moderna trial, by 2 weeks you get 80% protection, right? So they seem to be very happy. No, but it is not sustained. That's why you need a 2nd dose, which boosts it up to 95%. Plus, the T cells are activated, and this is important for memory, and this will ensure durability, long-lasting protection. Memory cells, yeah.
And that would cover Dr. Jaba's comment too, the reports of COVID positivity after first dose of Pfizer vaccine in only 1 dose. So is that what you're saying is we really need to have 2 doses, right?
The COVID was they were probably incubating the COVID before the
vaccine.
Yeah. And how long can the COVID vaccine be effective for? It's a $6 million question.
That's a $6 million question because but at least 4 months out now. Is
Okay.
Moderna. Yeah.
Okay, you want me to guess? You know, you look at the natural infection, the wild infection. We've had how many months of COVID now?
Millions.
10 months. 10 months of
More.
COVID. We've got about 100 million cases of COVID. How many reinfections have been reported? I saw one group reported 30, the British group reported 60, about 100 reinfections. What does that mean? That means the natural antibodies is actually conferring that amount of protection, yeah? But with the vaccine, you really achieve GMTs, geometric mean titers, which are much, much higher than the natural infection. So I am expecting a much longer protection than with natural immunity.
Natural.
Plus, the other bonus is that your T cells are being triggered, and you get memory cells, and you get durability, more longer and sustainable. Just I like to think positive lah. You're so gloomy like these days.
Yeah. Okay, there's a question about asthma and those predisposed to allergies taking the vaccine. Adeeba, I think you covered that.
Yeah.
But it's not an absolute contraindication. You can take it, stay in the clinic for about half an hour.
Half an hour.
Yeah. And then also those who are taking steroids or immunosuppressive agents like methotrexate, again, not a contraindication. Yeah, you can take.
There's lots
Pregnancy
of
also.
questions about pregnancy and breastfeeding. Yeah, we've answered that. Yeah.
Autoimmune disease, take the vaccine. Yes.
Take the
Yes,
vaccine.
they're high risk. They are very, very high risk. Take the vaccine.
Yes. There was a meme going around with Arnold Schwarzenegger receiving his vaccine. If you've seen it, it says, "Come with me if you want to stay alive." Follow me if you want to stay alive. Which is good. I think
Send a very powerful message. If you want to build your biceps, you listen to me. If you want to know about the vaccine, you listen to Prof. Adeeba. That's basically it's a very powerful message, man, from Schwarzenegger.
Yeah. We got to skim through the thing. I mean, they're talking about which vaccine brand is best for Malaysian population. What are your comments?
What does that mean? I mean, I think we've gone through the research and the efficacy of all the vaccines. One is, which is best. Of course, would be based on the most efficacious vaccine. But the second is actual availability of the vaccine, right? Because the whole world wants vaccines. So you've got to weigh all these things. What vaccines can you get your hands on that as quickly as possible and as large amounts as possible without compromising on safety. Yeah.
Should Malaysia abandon the idea of Sinovac and Sinopharm since there are no published phase 3 results?
No, I don't think we should. Hey, by the way,
now that we're doing our own vaccine trials, I believe that Sinopharm maybe will know the results soon. But hopefully it's in large enough numbers to make good conclusions.
Yep. You see, we have to give credit to our neighbors in Indonesia. They were part of the Sinovac trial, and that's why they got X million from China. Yeah. And that's about 68% efficacy. And Sinopharm were doing it in the Middle East. All right. And they got 86% efficacy. Well, press releases. But having said that, they have been doing it EUA, emergency use authorization or limited and early use since July. So they've already rolled out about 3 to 4 million of the vaccines. And of course, in the press release, they say all our frontliners, all our embassy staff have taken it, no issues at all. They've been protected. Those yang tak ambil, kena COVID. And then no safety signals as well. So don't shut them out, because whatever vaccine is available, let's look at the data, get NPRA to look at the data, and then hopefully license them accordingly based on the data.
So I think the answer is get whatever NPRA approved vaccine.
Yeah.
Yang mana-mana pun boleh, take it and
follow Arnold Schwarzenegger if you want to stay alive. Pregnant mother vaccine, we already answered that, yes. Okay, this one sounds like an anti-vaxxer question, Musa, for you. Metals used in vaccine might cause extra pyramidal side effects.
You know, this is another joy of the anti-vaxxers, you know. Not just the anti-vax, no, the two groups basically. The anti-vaxxers will say they're poisons. I'll tell them what's in the mRNA vaccine. You've got the mRNA, which is synthetic. Yeah. You've got the nanoparticle, which is polyethylene glycol. It's a chemical. And then you've got your lipids, yeah, the nanoparticle to encase the mRNA so that it can enter the cells in the cytoplasm, sit on the ribosome, make the proteins, the spike protein, and then trigger immune memory. Okay. And then you've got chemicals. You got sodium chloride, you got potassium chloride, you got potassium phosphate, you got sodium phosphate. These are chemicals we use every day in medicine. And then the last thing, you got sucrose. You tell me, where is the gelatin? Where is the animal protein? Where is the thimerosal? Where is the mercury? Where is the aluminium? Show me. That's my question to the anti-vaxxers and to the religious bigots, especially Muslims. These jokers, they everything is haram until proven halal. Hello, there is no animal protein in there. There's no bovine. There's no porcine. Okay, so please,
I'm glad it's Dato Haji Musa who's saying that and not me.
Show me the evidence. Okay, Alan.
For all those asking who. There's a question here about medical students. Should medical students be trained to help MOH in the distribution of the vaccines? And I thought I saw it in the MOH plans. Yes, so that would be very good if you guys came forward to assist.
Yeah. You know what, Alan? You know one of the main problems in the United States is they've got about 21 million vaccines, but they only could use or administer 7 million because the logistics, the process was just a failure, you know.
First, there were reports of them going, come, have the vaccine.
So you need to mass produce. So they already got the vaccine. They got 21 million. But mass distribution, they were failing. And mass administration, they were failing. So you know what? Paul of it was really... he said, you can open this town hall, open the synagogues, open the mosque, get all the people in there, shoot them in the arms. No point, the vaccine sitting in the refrigerator.
Yes.
So we need to get our act as well. That's why the medical students are equally important. All the nurses, all the GPs are involved in this mass distribution and mass administration.
Okay, that's a, sorry, I didn't unmute my...
That's a very important question here. For those low risk, less than 40 years, wouldn't getting exposed to COVID and building own immunity be safer than taking the vaccine? Now, you know, there's low risk and there's low risk. Of course, you know, as we keep saying, the 10% of people who do develop complications, who do develop cytokine release syndrome are those who are over 60, those with comorbids, diabetics, you know, high BMIs, hypertension, cardiac disease, etc., etc. But you know, there are also those without known risk who can develop severe complications, number one. Number two, there is this syndrome called the long COVID. Previously, people who get long-term symptoms that could range from, you know, debilitating fatigue to insomnia to, you know, chronic headache, etc., etc. A phenomena, a syndrome that's still being studied. So, why would you want to take the risk of getting COVID-19 with with the potential of getting severe disease, one, or of getting long-term complications, when by and large you have an effective, safe vaccine.
Yeah.
Yeah, can I just add, Alan?
Yes.
No herd immunity of any vaccine preventable disease has been achieved with natural infection, right? You need to do it with a vaccine. You look at some of the worst areas, California. What is the antibody status? 20%. Look at
Sweden.
less than 20%. So this is part of this great Barrington debate, let us all get the disease and build herd immunity. It does not happen. You just kill your citizens. You need to do the vaccine. A vaccine can achieve that minimum, maybe about 70% herd immunity, and hopefully you can protect the community.
Yeah. I think United States is a classic example. The number of deaths so far, way exceeding the number of deaths in the Vietnam War. So and Sweden's initial plan for natural herd immunity has sort of fallen into shambles. Yeah. So I think what you said is true. Let's move on, because we've really move on. There's a question for Adeeba. How does the mRNA vaccine know which cell to enter and produce a spike protein that is recognized as antigen?
Okay. How does the mRNA vaccine know which cell to enter? Yeah, I don't know. Musa, do you know the answer to this?
Biology, I think, you see, this is really smart technology. The human is so smart. The mRNA is in the nanoparticle. The nanoparticle makes it such that it sticks onto the skin and into the cell, and usually goes to the macrophages. And it just enters the cytoplasm. It is not allowed to enter or not able to enter into DNA, such is a nanoparticle. So it sits on the cytoplasm of the macrophage and then looks for the ribosome, and that's where it produces the proteins. Yeah, and you get your spike protein. Spike protein goes out, yeah, and then tells the body to make your antibodies, and your T cells is activated. That makes the memory cells, and also it makes the third cells called cytotoxic cells that eats up all your injured cells. So it's really smart, these guys.
So it doesn't pick
yes,
specific cells.
Yeah. Immune cells, I guess. Yeah.
Yeah, immune cells. Yeah.
As COVID can be asymptomatic, some individuals develop antibodies, and those with antibodies, do they still need the vaccine?
As COVID can be asymptomatic, some individuals have developed antibodies. Yeah, if we have antibodies, do we still need the vaccine? I think we sort of answered this before, and the answer is yes, because we don't know how long natural immunity lasts and how protected, because we know of secondary infections. Yeah.
Yeah. Plus, when you get the vaccine, you actually boost your GMT titers. Yeah. Plus, you also trigger your T cells for immune memory. Yeah.
There's another chap who's very afraid about negative side effects show up indirectly over long term in capital letters and exclamation mark. How do you know for sure all side effects will show up in 60 days? Maybe you want to reassure these worried individuals, Musa?
This is the science of vaccinology, right? When they look at all the vaccines and they found that all of the major side effects, whether it is interception with rotavirus, whether it is anaphylaxis, whether it is ITP, whether it is encephalitis, all of this, what you describe as long-term effects, appeared within the first 60 days. Yeah. This idea was actually, corrupted by what's his name, Andrew Wakefield. He said autism. Yeah. So this is the playbook of the anti-vaxxers. Yeah. So rest assured, we will see them within the first 60 days, but the FDA has mandated the manufacturers to make sure you follow up for 30 months. This is part of post-marketing surveillance or pharmacovigilance.
Okay, there are lots and lots of questions. I think we have to put a finite end to this session. I'm sure a lot of you, many of them are repeat questions. So if it's okay with you guys, we'll be going on for 1 hour, 21 minutes, max 1 hour, 30. Is that all right with you?
Okay, boleh.
Yeah.
Yeah, we don't want to go on until midnight or something like that. I can just.
No, neither do I.
I think those repeat ones we'll skip, like conceive baby, should I take vaccine? Yes. History and anaphylaxis, should steroids be helpful? They're given before vaccination as a prophylactic measure.
No, never. Because then you will what do you call it? Damn the antibody response. You should not be taking paracetamol, NSAIDs, or steroids prior to the vaccine. Yeah, because then you would blunt the antibody response. The GMTs, we found this actually with the pneumoconjugate vaccine, because some of them took Nurofen or ibuprofen before the shots, and they found that in this group, the GMT, the geometric mean titers of the antibodies produced, were lower in those who took the NSAIDs. So no is the answer.
Okay. This is one policy question. Should Malaysia implement new rules for compulsory vaccination?
Yeah, compulsory vaccination's always been a hot topic. I recall when we had this diphtheria debate or the resurgence of diphtheria 2 years ago. There was a call for compulsory vaccination. There are pros and cons to it. I'm not an advocate for compulsory vaccination, I must say. I don't know about Musa's views.
Yeah, I concur with the wisdom of Prof. Adeeba. Yeah, the fatwa that came out from the Minister of Religion, he said that harus, i.e. permissible, but if you are in the high risk group, the healthcare providers, your geriatric, and you have comorbidities, then it becomes mandatory. Personally, I don't agree, because yes, there are concerns. They still believe this is a 10-month-old vaccine. These are legitimate concerns. What we need to do is get a buy-in. So we need the Ministry of Health to mainstream the effectiveness, the safety, the kesucian of the vaccine, win them over. Those who are on the fence are probably about 20%. I think with good discussions like what we're doing tonight, we can win them over. The greatest advocate, in my opinion, are you guys listening, that 80% of doctors and nurses, healthcare providers, the consultants right down to the misi at the Pusat Kesihatan Kecil, you are the ones who are trusted by our rakyat. So if you project this friendly vaccine concern, and you advocate for vaccine, we will win them over. But if we have doctors, culprits, talking junk, misinformation and fake news, susah lah like this. And that's why I think the MMC should take action against those guys who are propagating this false news. Bring them to task, not being punitive, but show us the evidence.
Okay, there are really a lot of comments. If you're so confident, why haven't you taken the vaccines yourself? You're just waiting.
Yeah, we're waiting.
Yeah, waiting. I've had my flu vaccine, okay? I've had my pneumococcal vaccine. I've had my Tdap vaccine, the adult version of tetanus, diphtheria, and pertussis. So
I've had my influenza vaccine. My patients asked me, said, "Would you take it?" Definitely. The moment it comes, I'm going to have it. Yeah. So again, like Arnold Schwarzenegger says, if you want to live, follow him. Okay. And we already mentioned Norway death and all that. Now, these are all incidental deaths in old people. Okay, I think I think
there's a question about teachers, and I think there's been quite a lot of discussion of whether teachers should be considered a frontliner as well. And I think that's a good case for it if we want to start opening our schools up more confidently. Yes.
Okay, I think it's a question of supply. How many
supply
and the logistics? Yeah.
I think there's also a question about mixing the vaccines.
Yeah.
Generally, a quick answer would be not a good idea. Especially if they are of different technologies.
Will you also have different vaccines on 2 occasions? I think they did that doing that in UK or something. Was that something mentioned?
No. They were delaying the second dose.
I see.
They were trying to spread the first dose to as many people as possible.
Yes. Exactly.
Elderly and oral chemo take vaccine. Answer is yes.
Yep. You are the expert, huh? Ellen?
ASH guidance, yes, no contraindication.
Right.
Allergic to all painkillers except pethidine. Can I take the vaccine?
Boleh.
Need for we already mentioned about speed of vaccine and how the concern about the pace. I think we've talked about all this, so I don't think we need to repeat ourselves. And then we're talking about mRNA versus AstraZeneca versus Sinopharm, why we don't talk about comparison. Actually, we have to compare because these are, there's no head-to-head comparison. So what is that to compare? We only have individual trial data, but as long as the data becomes published and they're NPRA approved, we should use them. Okay, there's no head-to-head comparison. Plan for Malaysia to come up with own vaccines. Malaysia boleh.
You know what? We had 9 bio 14 years ago, Alamak. And then what happened, Sayang, look at the Indonesians, they got biopharma. Biopharma, they make the childhood vaccines enough for the whole of Indonesia and they export 40% to WHO, And that's why when China came, they already had the facility to do their trials. So now they are ahead of us, and I think Jokowi took the Sinovac vaccine one.
Yes.
So sayang lah, but I hear that one of the companies is doing a fill and finish with Sinovac, and but I'm very worried lah. There is a bamboo tiling company that wants to go into vaccine, and then there is an IT company that wants to go into vaccine. Has got no logistics, has got no research arm. I don't know how they get ethics approval lah.
Okay. Right, it's Malaysia. Yeah, Dr. Tan says biotech, the FDA approved, not every. I mean, none of the vaccines are FDA approved. They're all approved under emergency use authorization. Okay, I think we covered that already. The challenges of Pfizer and we need to deploy at -70. Any comments?
Okay. So far, no news, isn't it? I remember when there was one news in the States when they already brought out the Pfizer vaccine and they had to finish everything. Everyone came, habis. Yeah. Anyway, the lesson is I think we can learn from the Congo. Yeah, the Ebola vaccine which J&J did. It also had to be -70. They had this special thermos flask that can put 500. They can grow 1 week across the river and or drive into the kampong. So boleh lah.
Yes, and in more banks, -80 is no problem. Yeah.
How do you tell doctors who are anti-vaxxers? I think Musa has answered that. This is really quite sad, I believe, because we do have people reading and believing conspiracy sites as gospel and as scientific data.
I think
people
we just
know better.
We need to listen to the science, not to rumors and hearsay. Yeah.
Wow.
Is there a possible problem of increased severity of COVID-19? That's a relevant question. Just like happened with the Sanofi dengue vaccine, I think they meant like.
Oh no issues at all. This antibody enhancement, isn't it, with the dengue vaccine? No issues at all during the trials with the 100,000 participants. Yeah.
So if you had mild COVID, you vaccinate, no issue.
No issues. In fact, that's why one of the FDA indications for vaccine is a previous COVID. No issues. In fact, if anything, it boosts the antibody. And plus, I always mention this, plus it triggers the T cells because this is important for memory, for durability, and for sustainability of the protection.
Yes. Local media reports on side effects and deaths. Again, it's all sensationalistic reporting. Campaigns, I mean, government should. We also have events like this to educate everyone, doctors and public alike. I think there's a lot more information goes out to counteract misinformation. I think my panelists are doing an excellent job here. I hope you all agree. Yeah. Dr. Siva from PPS MMA, vaccine is arriving mid-Feb and roll out in March. MOH will not engage a primary care GPs who are persons closest to community. What's your suggestion? I think there's engagement already, isn't it? Yeah.
Yeah, I thought that's part of the plan. Yeah.
Yeah. I think getting the MMA is also helping getting the lists of names and clinics and so on. We can't cover everything, sorry. Yeah. So, this strong immune system thing better than taking the vaccine. Musa, I think this is your area again, combat that kind of misconception. There are people who say they want to prefer to take vitamin C and this and that.
They're selling something they're selling either vitamin C or vitamin D or whatever minerals. So everything has got a commercial interest in it. It's MLM, multi-level marketing. This is a lot of course, you want to keep healthy, the natural way. But there is no one magic bullet or silver bullet for COVID except for the vaccine. Yeah.
Okay. I think it's 1 hour 30 minutes past the mark. I'm sorry we cannot take all the questions. A lot of the questions seem to be repeat of what our panelists have covered. I think before we end, I just want to switch back to the poll, and I think we'll just re-vote again, and let's see whether we have changed your reception to the vaccine. So can you go back to Slido?
We will not our gaji tomorrow.
Yeah, let's see how convincing you guys were. If there are no contraindications, only 10, 11. Let's have more. We had over 200 votes, so just go back to your Slido, please, and let's see whether you'll be willing to take the vaccine. Let's say they're all the same. So yes or no? Very simple question. There's no standing on the fence, no unsure, so yes or no. Yeah.
What was the N at the start?
76% said yes.
No. Number of people who voted.
200.
Oh, I'll have to go back. Yeah. A few hundred voted. Yeah, a few hundred voted.
Coming through. I can sleep tonight.
Okay, Alan, you can buy us coffee and cake.
Hey.
Definitely. You guys
and get bonus this year.
Yeah. Look,
what's very important, Alan, is that these are all majority, 80% were doctors. If we get
medical students,
I think we've done it. Well done, Alan.
Well done, everybody. So I think we've definitely changed some minds. It's been effective. So I'd like to thank Prof. Adeeba and Dr. Musa for your excellent discussion and the audience for your questions. I apologize, we just couldn't take all the questions. It's just way too many. But it's so nice to see a 90% vaccine acceptance at the end of this. Okay, so thank you and good night. But don't go away. After this, we're going to have our MMA SCOMOS chairman who wants to give you a little, to speak to you a little bit about SCOMOS and something for doctors. Okay, so Adeeba and Musa, thank you once again. And
thank you, Alan, for great hosting.
Thank you. Yeah. Okay. Maybe this is my retirement plan, Adeeba.
What?
Become a full-time YouTuber. Okay.
Yeah, wow. You did a great job.
You got more this time round, 376
We had a peak of 1,900, nearly 2,000 views, live views for this video. So I think it's been fantastic. We've reached out to audience and it still be there and on the MMA SCOMOS page as well. So we should be able to continue to get that message. And I think it's always nice to have another session, maybe similar one in the future when we have more data and perhaps more questions to
Yeah, when the vaccines has arrived.
Yeah, when people start vaccinating, and then side effects start to appear.
Janganlah, you need.
Alan, my main concern is really us rolling it out, And
Yeah.
America, with all the infrastructure, failed to do it, only doing 1/3. I shudder to think what would be our performance.
Yeah.
That's why Paul Offit, this guy is amazing. Hey, by the way, 5 pediatricians sits on the FDA board that give the EUA, apart from IDs and all. And this Paul Offit sits there and he said, just open up your town halls, open up your synagogues, and let's deliver all the 21 million. We've only done 7 million, he says.
Well, what did Biden say? 100 million in 100 days? Something like that. Some big plans.
Okay. All right. Thank you, guys. Good evening, and
thanks, Alan. Good to see you.
Have a great weekend.
Thank you very much. Okay. Bye-bye. Good night.
I will hang on to the rest who are watching. If you can stay on, and I'm going to introduce the chairman of MMA SCOMOS. That's Dr. Vijay, who is now online on stage. Hi, Vijay.
Can you hear me? Hi, I'm here.
Hi.
Thanks, Alan. Thanks. And I think I miss Dato Prof. Adeeba and Dato Dr. Musa. But thanks a lot to both of them for an excellent event. I think we even almost touched 2,000 people listening to us on just the YouTube live account alone. I'm not sure how many more on the MMA SCOMOS page, but thanks a lot.
Did the live stream work on MMA SCOMOS?
I'm not too sure, but I mean, almost 2,000 is a huge number for us, and I think a lot of us benefited from the talk today. Excellent explanation from both the esteemed speakers. Now, just very short, I'm not going to promote SCOMOS or MMA here. Now, if you all are not members yet, I would ask for everyone to become members of the Malaysian Medical Association, because we need your voice for us to be able to voice out things to the relevant authorities. But more than that, I think what we need to look into is, I think it's been a tough year so far, not just 2020, but even the start of 2021. And none of us have the answer of when this pandemic will end. And on behalf of the Malaysian Medical Association, I would like to ask that all of us unite and let's save Malaysia. We recently got a lot of comments, a lot of complaints about items not being enough, and about mental and physical burnout. Yes, we hear you, and we will take action on this. SCOMOS and MMA will surely continue to proceed, and we have also requested for a meeting with the Prime Minister in the soonest time possible. But for all the doctors that are facing a tough time and need to speak to someone, we are here to help. We have multiple avenues. I've seen many on Facebook. We have Help Doc for doctors. We also have Mercy Malaysia, Befrienders. I think even every hospital has their MHPSS team. So at any point of time that you all feel help is needed, I think the best thing or the first start that you all can do is actually to speak to someone or get some help if you all really need. I think the number of Help Doc is actually put up on the screen right now, and also the email. So please reach out. Reach people, or at least speak to someone who you can actually get some support from first. And on behalf of SCOMOS MMA, we ask all healthcare personnel to stay safe and let's support each other and save Malaysia. I think that's all from me, Alan. That's all.
Okay, thanks, Vijay. So I think we will end the session now, and thank you everyone for listening. Everyone stay safe and have a good weekend. So good night. So selamat malam. Yeah, good night.
Thank you.